Good afternoon, everybody. Right, today's slightly different spin on things. We're going to go lower back pain. So managing lower back pain whilst you're isolated and stuck in, can't usually get to your physio or whoever you use, chiropractors, osteopaths, whatever sort of therapist you choose to use. So we're going to go through a couple of exercises, 3 in fact, exercises. Lower back pain can come from a multitude of different sins. However, most of the time, in my experience, it is dysfunction, and what I mean by that is a musculoskeletal problem. So mainly issues with imbalances of muscles, weaknesses in muscles, but of course there can be some pathology in the lumbar spine itself, herniated discs, some degenerative changes maybe. But let's not get too mocked up in that. Let's look at the 3 exercises we want to give you today. Keep them simple. So first one I'm going to show you is known a heel tap. Okay? So you're going to lie on the floor. Get your back impregnated into the floor. Lift both legs up, knees and hips as good as 90 degrees. Pull your tummy muscles in as tight as you can. Hands flat on the floor. Lengthen one leg and tap the floor. Keep this supporting leg here stable, okay? Then bring it back in line. That's 1 rep. Okay, you're going to do the same with the other leg. The exercise isn't actually the heel tap. The exercise is holding the stomach muscles in. So as you lengthen a leg, your lower back will want to curve off the floor. You've got to keep your lower back into the floor. If you feel it lifting away, you're not squeezing your tummy muscles hard enough. So remember, the exercise that you saw, me moving the leg, isn't strictly the exercise, it's holding the core muscles in. It goes exactly the same for this next exercise, which is known as bird dog. So, hands on the floor, knees on the floor, hip width apart. Find a neutral spine, so rock the pelvis to try to find that neutral spine, nice flat back. Pull the tummy muscles in, extend one leg and the contralateral arm, okay? And you'll do again the same the other leg. Look at about 10 reps each. And again, like I said, the exercise is holding the core in. When you extend one arm and the opposite leg, you're recruiting your posterior sling. Okay, so that's glutes and lats. They're working together. So that's going to give you some back strengthening. Your third and final exercise is banded push-outs. Now, I'm showing you with a band. I've got a cable machine here, obviously, but you probably won't have that. Most people have a band in their house, okay? If you haven't, Amazon's still delivering, get online. Right, get some tension in the band, pull it over into your midline, tummy muscles in yet again, okay, and you're going to push the band out. I'm going to show you from this angle. So actually maybe if you can come around here, you can see it from a different angle. So if you come to here, so I'm going to push the band out, okay, and pull it back in. So what's happening there is when it's out, I'm resisting rotation of the spine, okay? You need to understand that. So get some tension on the band as I push it out. Your levers are at their longest point. You are resisting spinal rotation, okay? Done one side, quite obviously, you need to turn around and go the other side. So that's going to recruit the muscles that hold your segments, your vertebrae together. So you've got an exercise to recruit your TA muscles, your transverse abdominis with the heel taps. You've got your bird dog, the next exercise, which recruits your posterior sling, all the musculature on the back. And your third and final exercise, banded push-outs, which is going to recruit your deep spinal inner unit muscles, known as multifidus, to resist rotation, okay? If you look at 10 reps of each of those, and you can do them 3 or 4 times a day, okay, but do remember throughout all of those exercises, it is the drawing in of the tummy muscles and holding that tension in there, okay? I'm going to bring some more videos along. Shoulders, neck pain, my passions are neck, shoulders and lower back mainly I work with, okay? But if you've got any issues, hips, knees, ankles, maybe send me a message and I can put some more videos together going through a few exercises for those. Anyway, good to see you. Take care.